Let us start the function with the inauguration and welcome address by Dr. B.S. Srinath. Dr. B.S. Srinath, popularly and lovingly known as BSS Sir, he is a senior consultant surgical oncologist and head of the institutions and managing trustee at Sri Shankara Cancer Hospital and Research Centre, Bangalore and Bhubaneswar. Invite you, sir.
Esteemed visiting faculty members for this conference, Dr. Prithvish, our Dean of Faculty, my colleagues and students. It has been in the offing for a long time that we should have a conference on the complications while dealing with head and neck cancers. If any surgeon is doing surgery, he is bound to have face complications. If anyone boasts that he does not have any complications, you may assume that he hasn't done many surgeries. This is an old adage which applies always. We thought we will focus on the complications because the surgery of head and neck cancer is becoming more and more intricate, gradually enveloping and encroaching into the areas which are more difficult, where we work along with the neurosurgeons, and then in many cases what we earlier thought was not curable, we are able to achieve cures. Advances in science and technology has added to our understanding of the staging and the evaluation of the head and neck cancer patients. Yet the difficulties on the table while doing surgery is not uncommon. It is critically important that we anticipate the complications, we prepare for the complications, and we try to avoid the complications. And if it does any complication occur, then we should have the tools and the devices to face and treat the complications. So this was one of the most important thoughts that were crossing, and we thought we will not be able to cover the entire gamut of the issues related to the head and neck oncology in one conference. We thought we will do that in a series of 4 or 5. And while doing so, we have also consciously given sufficient time to each of the speakers, and also for the students to interact in between the conferences. We have given some free time. Since this involves technical skills and understanding, it's not learned through reading the publications or the textbooks. You should talk to the people who have faced it and learn from them, and that way giving sufficient time for the students to discuss with the faculty members and people who have spent years together in developing the head and neck oncology in India are here today. And so we thought we will give sufficient time in between the talks and also sparsely position the talks. Now, I am extremely happy, and indeed I am grateful to the eminent faculty representing who is who in the head and neck oncology in the country are here. And I was so happy the moment I heard that Professor Sultan Pradhan has agreed to come here physically, and along with Professor Prathamesh Pai, the doyens of head and neck oncology. I know Professor Sultan Pradhan. In 1983, I worked in the head and neck department for 6 months as a trainee under Professor R.S. Rao, and you were the consultant surgeon working with him. And I had opportunities to assist maxilla, thyroids, and things like that. I think R.S. Rao was very fond of thyroid surgery. And I have been following it up. Many of my patients have gone and got subsequently operated by Professor Sultan Pradhan, and they are fine, doing well. So I am so happy that all of you have come at our request to give lot of knowledge to the youngsters who are the budding future head and neck surgeons in our country. I heartily welcome on behalf of all the trustees and the family of Shankara here. I welcome Professor Pradhan, Dr. Prathamesh Pai, all the colleagues from Tata Memorial Hospital, Sidwai Cancer Center, and from Mata Amritanandamayi Institute in Cochin and other places from Hyderabad and Chennai and all the other places. And we have a couple of speakers participating through the Zoom. And I, on behalf of all the faculty members of Shankara, I welcome them also. Today and tomorrow will be a feast. Soak yourself well, spend time in between, talk to the people, faculty members and teachers individually, try to know how they solve the problems. And we have doctors from Bagchi Sri Shankara Cancer Hospital in Bhubaneswar. I welcome them also. And I am waiting to see that this conference will be one of the best in delivering the issues, the problems being solved in the complications of head and neck surgery. Thank you very much.